Most people don't think twice after flushing the toilet. But what if I told you that a quick look into the bowl could reveal more about your health than you realize? Your body is constantly talking to you, and one of the easiest ways to listen is by checking the color of your pee. It might not sound glamorous, but it's one of the most direct, everyday indicators of what's happening inside your body. And the truth is, urine isn't just waste. It's a reflection of your kidneys, your hydration, even your diet, medications, and more. So yeah, your bathroom break? It's basically a free health update. You've probably heard that the color of your pee can tell you how hydrated you are. That's true, but that's just scratching the surface. There's an entire rainbow of pee colors, and while many of them are harmless, some can be a sign that something more serious is going on. That's why we talked to medical experts and gathered the info you need to know what's normal, what's not, and when it's time to talk to your doctor. Let's start with the basics. What color should your pee be? There's no one perfect answer. Everyone's a little different, but in general, your urine should fall somewhere on the yellow spectrum. The yellow hue comes from a pigment called urobilin, which is produced when your body breaks down old red blood cells. That pigment is then excreted by your kidneys, so the more water you drink, the more diluted that pigment becomes, and the lighter your pee will look. If your pee is nearly clear, it probably means you've had a lot of fluids. You might even be drinking more than you need. Believe it or not, yes, it's possible to drink too much water, but if your pee looks like a pale straw color or a light, transparent yellow, that's ideal. That's a good sign your body's in balance, and your kidneys are doing exactly what they're supposed to. On the other hand, if your pee is a little darker, say, amber, honey, or deep yellow, it could mean you're dehydrated. When your body isn't getting enough fluids, your kidneys hold on to as much water as possible, and your pee becomes more concentrated. That concentration not only makes the color more intense, but it can also lead to a stronger smell. Being dehydrated doesn't just affect the color of your pee, it affects your whole body. You might feel sluggish, tired, even dizzy. Other signs include dry mouth, headaches, and in some cases, even bad breath or muscle cramps. So if you notice your pee is turning that deeper yellow or orange tone, the first thing to try is upping your water intake. Aim for at least 1.5 to 2 liters of water per day, not counting other drinks like coffee or juice. And keep in mind, some beverages like caffeine and alcohol are diuretics. They make your body lose more fluids, so you may need even more water to stay balanced. Sometimes, though, a change in urine color isn't about hydration at all. Certain medications can affect the color of your pee. For example, if you're taking phenazopyridine, a medication often used to relieve urinary tract pain, it can turn your pee a bright orange or red-orange. Another one is sulfasalazine, used for conditions like ulcerative colitis, which can also create a darker tint. These changes aren't usually dangerous, but it's important to know their normal side effects, so you're not caught off guard when you glance down. But what if your pee is brown, like cola brown or dark tea? That's when you should start paying closer attention. In some cases, it could be something as simple as what you ate. Foods like rhubarb, fava beans, or even aloe can cause your urine to darken. But if you haven't eaten anything unusual and your pee consistently looks dark brown, it could be a sign of severe dehydration beyond the normal yellow stage. That means your body is so low on fluids, it's pulling water from every possible source just to keep your organs going. In this case, your kidneys are filtering very little water, and the waste in your system becomes highly concentrated. It's basically your body sending out a distress signal, but there's also the possibility that brown urine could indicate something medical. For example, if you've recently had a urological procedure, brown coloring could be from old blood breaking down and passing through your system. Certain antibiotics, laxatives, and other medications can also create this effect. In rarer, more serious cases, dark brown urine can be a sign of rhabdomyolysis, a condition where muscle tissue breaks down after extreme exercise or trauma. If you've recently done an intense workout and now notice muscle weakness, pain, and dark pee, it's time to call your doctor immediately. Rhabdomyolysis can lead to kidney damage if not treated quickly. Brown urine can also be linked to liver issues. When the liver isn't working properly, it can allow a dark pigment called bilirubin to build up in the body. If bilirubin ends up in the urine, it gives it that dark tea color. If you have a history of liver disease, or you're noticing other symptoms like yellowing eyes or skin, this isn't something to wait on. It needs medical attention. And for individuals with a history of melanoma, brown-tinted urine might even signal that cancer is progressing. It's rare, but it's another reason why noticing and tracking these changes is so important. Now, let's move into another surprising category: red or pink pee. If you're seeing this for the first time, don't panic. The most likely reason is something you ate. Beets, blueberries, rhubarb, they can all tint your urine reddish. It's harmless and temporary. Certain medications, like the antibiotic rifampin, can also cause a reddish hue. But if you haven't touched any of these foods or meds and you're still seeing pink or red, there's a chance it could be blood in your urine. That doesn't always mean something serious, but it's definitely something to check out. It could be a urinary tract infection, a kidney stone, or even a sign of something more complex going on in your urinary system. And just because you see red doesn't mean it's necessarily coming from your bladder. It could be from elsewhere. Sometimes, a small irritation or cut from wiping too hard is enough to cause a little blood, which might mix into the toilet water and look dramatic. But if what you're seeing is more of a deep burgundy or a dark red like Cabernet wine, don't ignore it. That could be a bigger warning sign, and it's best to get it checked out sooner rather than later. So, we've talked about the yellows, the oranges, the reds, and even browns. But what if you go to the bathroom and suddenly see green, or even blue? That might sound like something out of a sci-fi movie, but believe it or not, it happens. And before you start spiraling into panic, let's break it down. More often than not, green or blue pee is caused by something completely harmless. Artificial food coloring, especially from candies, beverages, or processed snacks, can sometimes tint your urine strange colors. Even vegetables like asparagus can contribute, not just with their well-known odor effect, but with a light greenish tinge too. And some medications can be the culprit. Everything from antacids to antidepressants to muscle relaxers have been known to turn pee different shades of green or blue. It all depends on how your body processes the ingredients, how your kidneys filter them, and how concentrated the pigment ends up being when you finally go. But here's where you still want to be alert. While most cases are nothing to worry about, a green or blue tint can sometimes be the sign of a rare urinary tract infection caused by specific bacteria, especially Pseudomonas. This bacteria can create a greenish hue in urine and is often accompanied by other symptoms, like a strong smell, a burning sensation when you pee, and even fever or chills. These infections aren't super common, but they can be pretty stubborn if not treated. So, if your pee looks a little like mouthwash and you're feeling off in other ways, it's time to get that checked out. There's also an extremely rare genetic condition called familial hypocalciuric hypercalcemia, which can sometimes cause blue urine. If you've never heard of it, that's because it's uncommon and usually identified during routine lab tests, not because your pee turned neon one day. The important takeaway? Pee color by itself is not a reliable diagnostic tool, and as tempting as it is to Google, "Why is my pee blue?" doing so usually leads to unnecessary stress. That's the thing about urine color. It can be influenced by dozens of totally normal, everyday factors: what you ate, how hydrated you are, whether you're on a new medication, or even what time of day it is. Your morning pee, for example, is almost always darker than the rest of the day, simply because your body hasn't had water in several hours. But if the change in color is dramatic, persistent, or comes with other symptoms, pain, fatigue, fever, or just feeling off, that's when you should reach out to your healthcare provider. Don't rely on internet forums or social media guesses. A quick visit to your doctor or a simple urine test can give you peace of mind and ensure nothing serious is going on. Also, remember this: your body is smart, and it's constantly giving you clues about how it's doing. Urine isn't gross or something to ignore. It's a tool. Your pee can reveal whether you're drinking enough water, how your kidneys are functioning, and even if you're developing issues with your liver or muscles. But it's also not something to obsess over. Most color changes are temporary, harmless, and easy to explain once you look at your overall lifestyle. That let's circle back to something important: hydration. One of the most common reasons your urine color changes is simply due to how much, or how little, water you're drinking. Your body needs water to function, not just to keep you from feeling thirsty, but to regulate your temperature, protect your joints, aid digestion and help your organs flush out toxins. When you're dehydrated, your body has to work overtime. Your kidneys start concentrating urine to preserve every drop of fluid, and that's when colors start shifting to amber, orange, or even brown. The good news: this is one of the easiest problems to fix. Start carrying a reusable water bottle. Set reminders if you need to. Add a slice of lemon, cucumber, or mint if plain water isn't appealing. And remember, consistency matters more than quantity in one sitting. You're better off sipping throughout the day than trying to chug a gallon all at once. But again, there is such a thing as too much water. If your urine is always completely clear, it may be a sign you're overdoing it. Overhydration can actually dilute important electrolytes in your system, like sodium, and lead to other complications. This is especially true if you're exercising heavily, sweating a lot, or taking medications that affect fluid retention. So aim for balance. Listen to your body, and let the color of your urine guide you. Within reason, that if you're still curious about what might be affecting your urine color, keep a mental checklist of the last 24 hours. Did you eat any beets or berries? Did you start a new supplement or prescription? Have you been drinking enough water? Or maybe too much? Did you work out extra hard? Or are you feeling sore in a way that's out of the ordinary? These small changes often show up in your pee long before you feel anything else. And here's something else worth remembering. Just because something looks strange in the toilet doesn't automatically mean it's dangerous. For example, if you're on your period or had sex recently, the urine in the toilet might look tinted simply because of blood or discharge mixing in. That doesn't mean it's coming from your kidneys or your bladder. It might be external and harmless. Still, if you're unsure or notice other symptoms, it's always better to play it safe and get a professional opinion. Let's also address a quick myth: the idea that holding in your pee is totally fine. It's not. Doing that too often can actually irritate your bladder or even increase the risk of urinary tract infections. Your body was designed to tell you when it's time to go. Listen to it. And while we're at it, wiping front to back, staying clean down there, and urinating after sex are small habits that can go a long way in keeping your urinary system healthy. At the end of the day, the best case scenario is when your pee is light yellow and doesn't come with any strange smells or sensations. That's your body's way of saying, hey, everything's working just fine. And if the color changes from time to time, that's normal. Don't stress unless the change is persistent, extreme, or paired with other symptoms. Your urine is just one small part of a bigger picture, and when it comes to your health, context is everything. So the next time you head to the bathroom, don't be afraid to glance before you flush. You might just catch a little clue your body is trying to send you, and if something seems off, don't panic. Just check in with your doctor. Because honestly, your health is worth more than a quick Google search or guessing game. The toilet bowl might not be glamorous, but when it comes to early warning signs, it's one of the most honest tools you've got.